for this opportunity. And this particular conference or gathering is very important because these are the opportunities. They actually help us understand each other. This is actually a meeting of mine. I was very much impressed and I learned a lot in the inaugural session. And most of the points which I'm going to touch upon, they are already discussed by honorable dignitaries, Honorable Vice Chancellors of D.Y. Patil University and Honorable Vice Chancellor of Gujarat Technological University. And of course, the organizers, they have the same idea. This workshop is going to be on recent trends, advancement and opportunities in phytochemical research and development. This is an opportunity to meet many of us. Unfortunately, we don't have that opportunity to meeting in person, but we are using technology. Now, this workshop is all about recent trends, but this recent trends is going to be discussed from knowledge traditions. Everybody mentioned about traditions. For analyzing trends, it is important to know the traditions, and then we can plan advancements. That is the connection why we are starting from traditions, and hence change scenario, they change our perceptions, right? The same thing looks very different if the scenario changes. That happens in biological research, and hence along with the situation, the context is also very important. I remember when I was an Ayurveda student in 1995, this was a case. Researcher from United States, they filed patent on turmeric, and there was a lot of discussion, and people realized that traditional knowledge is not only something written by the great grandfathers or people, though they existed in history, but traditional knowledge can be an engine for economical development. Traditional knowledge can be not just notes, those have been written or authored at ancient times, but traditional knowledge can generate a lot of science. And this is the scenario. We are now experiencing COVID-19 pandemic. Every day, a different news, Omicron variant. Now, that has been reported, patients in Pune, right? Scenario is different. And this pandemic has made us rethink, revisit so many things that taught us several lessons. It taught us that disease prevention is very important. Health is not just human repairing industry. Self-care. What happens in our family? My family, my responsibility. Home-based care. The lockdown was an unprecedented event, a drama that made us introspect, that taught us the value of the leaves, plants, even dietary substances in our home and around us. It taught us that strengthening our immunity, maintaining our health, improving our health status is the key issue. And hence, health traditions, they are again in the scene with a newer interest, with a new perspective. And hence, people they now realize that traditional wisdom may offer interventions and solutions for the present day health problems. And health problems, these are not just related to metabolic diseases. Health problems, they're not just related to musculoskeletal diseases of old age and diseases of lifestyle, but health problems, those are also, they also cover acute infectious diseases, life-threatening conditions like COVID-19. In such scenario, also, traditional knowledge can play a vital role and can be a source for knowledge. It can make researchers work for several concepts. And with this understanding, we are going to look at the traditional knowledge. Health for all is actually a dream, right? We are just struggling with a virus and its several variants. We are struggling with a disease, global pandemic. But somebody, they thought about, can health be made available for all, right? And hence, this is a dream that was proposed in WHO Almaty conference. We public health researchers, we always refer this dream. And hence, the speech that was really delivered in this Almaty conference that said, to make real progress, we must stop seeing the world through our medically tinted glasses. Discoveries on multifactorial causation of disease for a long time called attention to the association between health problems of great importance to man, social, economic, and other environmental factors. This statement that was made more than 40 years ago, that still holds an importance. And hence, we need to really think about that particular dream, health for all. Now, can we think about the healthier world and how traditional knowledge can be helpful to achieve the goal? I'm going to share some of the thoughts, some data, and ongoing experiments with the audience. How we can leverage on traditional knowledge for addressing various healthcare problems. These are the changed perceptions about Ayurveda today. It is not just a traditional system of healing, but it has a health promotion and disease management approach. Many times, we doctors, we tend to forget that we are here to maintain health of people. It is also important to introspect and ask ourselves a question. We all are health researchers. Are health researchers healthier than general population? Are doctors healthier than general population? How we can think on health promotion. And hence the first important lesson of Ayurveda is swasthasya swasthya rakshanam. Health is something that we need to protect, we need to promote, and hence we can prevent diseases. We can have simple yet very effective interventions. Like Modi ji said, when pandemic began, kadha peete rahiye. Something that we can prepare at home and consume at home. Thus, interventions, health interventions can be individualized, but holistic. We also need to think more than a capsule which can be prescribed to a person or a patient. There are so many things more than a capsule or a decoction. Scientific exploration of traditions is needed, and there are many opportunities for drug development, developing new interventions, innovative approach, and that this pandemic provided many insights for understanding human and environment connection at various levels of biological organization. How we have missed so many opportunities for studying Ayurveda. I'm just giving an example because this is the audience, and this audience is active at their institutions and in their labs. But we need to also have this particular aspect of, we also need to know about our ignorance. We also need to know about what we don't know. This is immunology timeline, thanks to Wikipedia. And right from 15th century, what are the developments related to our understanding of the immune system? It has been sequentially enlisted. But this particular timeline doesn't mention Charak Samhita, which is more than 10,000 BC. What Charak Samhita says about immunology, Ayurveda concept of immunity. Charak Samhita says that there is a concept called as Vyadhi Kshamatva. That is the concept that is written in Charak Samhita. It says, this is the definition of Vyadhi Kshamatva or immunity in Charak Samhita. In Sanskrit, it says Vyadhi Utpada Pratibandhakatva and Vyadhi Bala Virodhitva. Means the body's ability to prevent disease and maintain health, and body's ability to resist a particular disease is called as immunity. And hence, there are several aspects of mentioning immune status or bala. Sahaja bala means we born with that sahaja bala, that's innate immunity. Kalaja bala, there is a chronological influence. Our immune status is continuously changing entity. It's not just we get something and then we are protected, we got a shield. It depends on day-night cycle, it depends on yearly cycle, seasonal variations. And we can also develop our immune status with a particular therapy. And I'm going to talk about Rasayana therapy. And I'm going to discuss some of the research on Rasayana, and Rasayana that deals with rejuvenation, regeneration, immunomodulation, and anti-aging interventions. And hence, how we can attain a good status, Uttama Bala of a person. And that is the quest for all Ayurvedic classics. If you have a quick look at what knowledge and what wealth we have about Ayurveda, then we have more than 1 lakh books. Those are not yet published. We have most commonly used 57 basic classical texts. In those texts, there are more than 5,000 disease types, subtypes, specific situations to manage. They are scientifically enlisted, and several formulations, treatment, and reverse pharmacology approach. I'm going to discuss what reverse pharmacology approach is. That is conceptualized by a great scientist and our guru, Dr. Ashok Vaidya, as Honorable Vice Chancellor Sir mentioned about it. This is the knowledge base, and this particular knowledge base can be very important for development of traditional medicine inspired approaches to drug discovery. And this is a very good review authored by my mentor, Professor Patwardhanji and Dr. Raghunath Mashelkarji. And that was published in Drug Discovery Today. And that discusses how Ayurveda can be explored for drug discovery, how it can expedite drug research, because we are not starting from unknown. We are starting from any new chemical entity that is going to be used for the first time in humans. We are starting with something what we know. We are starting with something that has been successfully, safely, effectively used by population. And how traditions and technology can be harmonized, can give and take each other, and how that synthesis can move forward. This review, I recommend everyone to read this very important review, and this particular review generates many questions for a student of Ayurveda like me. It also discusses what is Ayurveda, what are the objectives of Ayurveda, what components define Ayurveda, and how Ayurveda can be communicated. Ayurveda is not something that is enclosed, restricted, and limited to 57 classical texts. Ayurveda is all evolving knowledge. Hence, many of my Ayurvedic practitioners and colleagues, they could effectively treat a new disease, that is COVID-19. Because Ayurveda is necessarily a thought process. How we look at the surroundings and how we can learn from nature, and that learning, how we can implement for protecting our health and addressing health challenges. This is a system Ayurveda poster we published, and that poster really defines what Ayurveda is. It is not just a particular extract of a root of a medicinal plant, but it has a philosophy of health, balance, and how we can utilize the surroundings for our health, and not just for our health, but for our internal environment and external environment as well. Ayurveda is a health science with an objective to protect and restore health. It has approach of soil and seed. That means if we have a good host defense, then the risk factors will not be able to initiate the process, that is pathogenesis. The goal of treatment is optimizing homeostasis, strengthening immunity. And hence, if you ask an Ayurvedic physician, the treatment approach is host-centric and not the disease-causing. Yes, we do consider various interventions related to causative agents, but the emphasis is on host strengthening, host defense. Health interventions, they have an array of several actions. They start from daily routine, seasonal variations, diet, lifestyle, and behavior. Therapeutics or treatments, they are personalized yet specific to that particular person, that particular etiology. Thus, a balance of holistic as well as personalized is maintained in Ayurvedic thought, in Ayurvedic preventive as well as therapeutic approach. And hence, diet, lifestyle, medicine, and behavior are the components of Ayurvedic thinking for health. We researchers, we follow very strict protocol in our laboratories. Our engineers, they also follow a very systematic approach, several standard operating procedures, several protocols, several standards, several checklists. But do we follow SOP for ourselves? Do we follow a checklist, a protocol for maintaining our own health? This is a very important question that makes us introspect. If we don't get involved in our own health and we try to outsource our health by getting some pill or getting some shot of vaccine or getting some dietary supplement, we have to get involved. We have to manage our daily routine in such a way that will take care of our daily activities, daily responsibilities, and our lifestyle. So that is very important aspect, and hence Ayurveda calls it as Swastha Vritta. It says if we follow proper diet and behavior, what is the use of medicine? What is the need of medicine? If you follow proper diet and lifestyle, what is the need of medicine? If we don't follow it, then what is the use of medicine, right? And hence, along with medicine, this particular aspect is very important, and in research that is coming up as lifestyle research, behavioral medicine. That behavioral medicine, lifestyle medicine, they talk about how lifestyle and behavior can actually be therapies. Thus, Ayurveda is not just notes or a compendium that discusses this is the drug or this is the medicinal plant and these are the properties where it can be used or included. It has a sound background of cause-effect relationship. And this particular knowledge tradition is helpful, and then that makes a modern age Ayurvedic practitioner to address or to treat a new disease like COVID-19. That also makes this particular background or this particular guideline, this thinking or approach that enables us to interpret any new causative agent, new diet, new lifestyle, new particular symptom complex, and address the same. That is the important aspect of Ayurveda, along with listing of drugs. And hence, it says that repeated observations, judgment of any intervention or drug, clinical application, meticulous documentation, revalidation by multiple trials. For example, any theory that requires proof of cause-effect relationship with multiple reproducible trials. That is the statement of Charaka Samhita that says what is a theory, right? And hence, this particular approach is very important. If we look at development of Ayurveda in modern era, and if somebody wants to read publications, Ayurveda related publications on PubMed, then there are many interesting papers and many interesting events. There is a case report by a patient that was communicated in Indian Medical Gazette in 1885. And interestingly, that case report is about ashwagandha or Bidania somnifera and its effect for beneficial effects for managing an infectious condition. There are many events in India. Government Ayurveda College that was established in 1889, 1913, an Ayurveda College in Satara, and there are so many developments related to Ayurveda. There were 3 centuries, age of engineering, age of chemistry and physics, and this is the age of biology and life sciences. There are many milestones even in era of biology. Human Genome Project, systems biology, epigenetics, human microbiome project, integrated human microbiome project that talked about how our microbiota can be different in health and disease status. Systems medicine, how we can utilize advancing biology for redefining medicine. There are so many new organs, new understanding of human biology is being reported. And in this, there are various efforts in India and in several countries on policy and regulatory framework, efforts for quality, standardization, and as Honorable Pawar sir also mentioned about standardization, quality control aspect that many times finds lacuna in some local market-based formulation. Ayurveda biology program, rising number of Ayurveda research proposals, increasing awareness, major gaps between people, practitioner, policy, researchers, and practitioner, teachers, and researchers. And hence, there are several initiatives by Ministry of Ayush and several other funding agencies of India and abroad, and development of integrative medicine. There is an emergence of integrative medicine. Now, many thought leaders, policymakers, doctors, they are thinking that not only a particular system of medicine could be effective alone. We have to bring the best from various systems. We have to bring them and synergize them for the benefit of people. And hence there is a global interest on systems medicine, integrative medicine, and several universities of all over the world. They are now started Department of Integrative Medicine. There are regulatory developments in Western countries where Ayurveda is becoming a formal, legally accepted healthcare system. There are many rising publications, and I'm going to take you through a very quick journey through some of the publications. This is the research on 100 drugs in last 100 years. There are so many rising papers, and if the perspective also matters for this research. For example, what do you mean by term research? If we ask a question, what do you mean by research? Then for many postgraduates or many researchers, it means different things. And it is not only related to grants and projects, but it is related to an approach. There have been various misuse and abuse of term research, many compilations and original thoughts, but blindly following published literature and invalid outcome measures, self-derived scales, and outdated analysis, data presentation, and following research methods and designing without understanding them. That happens many times in herbal drug research, natural product-based research, and we have to avoid such misuse or abuse of research. Are we studying diseases or are we understanding health? This is a very important question. And many times, herbal drug research, those who criticize herbal drug research, they say that any herb, if you mix with something, administered in any way, will produce something. There is a profound verse in Sanskrit, yasya kasya taror mulam, yena kena pamishritam, yena kena pradatavyam, yadva tadva bhavishyati. Anything, if we mixed and used, something will produce. And this particular approach is not important, not relevant. And there has been various classifications of modern medicine and classifications of Ayurveda interventions, and you will find classification of Ayurveda interventions, they are more related to strengthening health systems, like Balya means improving health, improving tissue, strengthening our senses, improving digestion, cardiotonic, improving vitality, promoters, restoration, etc. So classification of Ayurvedic drugs is certainly aimed at strengthening health systems. And hence, taking some animal systems and using or comparing a particular drug with existing anti-inflammatory, antibiotic, anti-malaria, or anti something is not really the Ayurvedic research, but understanding how it can help and how it can strengthen health system, that should be the approach. Therapeutics of Ayurveda is personalized yet comprehensive. It includes medicines, various therapeutic procedures like panchakarma, diet, lifestyle, medication, also meditation, and they are customized to disease type. Right? Hence, there is no generalized intervention, it is a customized intervention. Healthy long life, complete health, balancing state, disease control is important than just only managing symptoms. And hence, medicines of Ayurveda, they are multidimensional. For example, one particular formulation, Triphala, if it gets administered with different vehicle, different anupan, what we say. For example, Triphala with ghee and honey, that promotes eyesight. Triphala as oil, that is helpful for non-healing ulcer. Triphala as a decoction is helpful in liver diseases. Triphala with rock salt, that helps in as a carminative. Triphala as powder. Triphala with sugar is helpful in acid peptic disease. That's one particular formulation may have different target organ and different therapeutic function if it is administered differently at different time. This is very important aspect that needs to be implemented while we devise our experiments. Safety and specific indication of disease subtype. There is a specificity of action, formulation types, they determine the therapeutic properties. For example, one particular botanical like Tinospora cordifolia or Guduchi, it has so many effects on our body systems. And hence, with a specific way of using, that determines how that particular Guduchi can be used in several diseases with a specific way of administration and dosage. This is the strength of Ayurvedic botanicals or Ayurvedic medicines. We have discussed many such concepts in the book, that is Integrative Approaches for Health. The concept of Rasayana, that I'm going to spend some time on this concept, being a very important approach, a very unique approach, and that is health promotion, that deals with nourishment of tissues, immunomodulation, anti-aging, and rejuvenation. That is important in health and disease, both. That can be specific to constitution, tissue type, disease risk, disease history of that participant, and that became very important in COVID-19 research. For example, the health intervention can be very specific to a particular person, and hence it can be based on constitution, it can be based on disease type. So in clinical medicine, we give a lot of emphasis to this particular factor. Health research current scenario. If we have a quick look at current scenario about health research, then the concept of cause-effect relationship is not just presented by the researchers like Austin Bradford Hill, but that also existed in Ayurvedic thinking. Wellness. Now people are moving from health to wellness, and wellness is a condition in which the individual moves forward, climbing towards higher potential of functioning. Not just absence of disease, but optimal functioning of our mind, body, and optimal productivity of our mind and body put together, mind, body, spirit, that talks about integrated system. And this is the concept which has become so much important. Then hallmark of health. This is the paper that was published last year. And this was published in a journal called Cell, that discusses various aspects of cell biology and molecular biology, but that tried to define health as our responses to stressors, maintenance of homeostasis, and our time and space compartmentalization. This particular paper talks about the concept of health as mentioned in classical Ayurvedic text. This is more operational or functional concept. Another paper, that is circadian mechanisms of medicine. This is another example how Ayurvedic thinking is now moving forward in modern biology. The Ayurvedic research is a continuously growing phenomenon. There are several experiments on Ayurvedic concepts. A program that is called as Ayurveda Biology that tried to explain several Ayurvedic concepts, several classifications of Ayurvedic drugs. For example, the concept of anti-aging that was communicated in a paper, that is Ayurvedic Amalaki Rasayan, is a formulation, Chavanprash-like formulation that improves stress tolerance and anti-aging effects in Drosophila. And then Rasayana, Amalaki Rasayana, a traditional Indian drug, enhances cardiac, mitochondrial, and contractile functions in rats with cardiac hypertrophy. This is again how concepts like Rudya, concepts like Vayasthapan, Rasayana, they're being tried in advanced modern research. Genome-wide analysis of Ayurvedic Prakriti has been reported by our group, that is immunophenotyping in normal individuals, classified on the basis of dosha Prakriti, doshas phenotype specific Ayurvedic intervention in asthma. These are the studies. They really try to investigate the personalized concept of Ayurvedic medicine. Ayurveda Biology or Science Initiative in Ayurveda, this was a program by Government of India, and that program included series of various projects exploring science behind Ayurvedic concepts. This program included Genomics, that is genomic basis of Prakriti, then validation of Rasayana therapy, immunological and metabolic effects of Panchakarma, which is the therapeutic procedures being practiced by Ayurvedic practitioners, Amalgamatic Rasayana on DNA repair and immune profile in humans, studies on biological effects on Rasayanas and Bhasmas, characterization of physicochemical properties of metals and minerals-based drugs, functional genomics for understanding holistic principles of Ayurvedic therapeutics for asthma, role of Maidya Rasayana on aging and bioactivity studies with Bhasma. So these are some of the recent studies, those reported on several Ayurvedic formulations. Now, we're going to again look at Ayurveda and COVID-19, chronic diseases to acute infectious disease. So COVID-19 has put Ayurveda on the front seat to manage acute infectious disease, and it highlighted limitation of outsource health, and I discussed how COVID-19 has put Ayurveda in a new era of newer expectations and newer experimentation. We all know that everyone has a quest for healthy and happy long life. That is a concept of immorbidity, how we can live a healthy long life that is being proposed, and Rasayana is the mean to attain excellent qualities of tissues. Thus, Rasayana is the concept that attains longevity, memory, intelligence, health, usefulness, excellence of complexion, voice, and our tissues in general, optimal strength of sense organs and physique, and perfection in deliberation, respect, and brilliance. Ayurvedic therapies, they have Rasayana approach, that is several dimensions such as immunomodulation, anti-aging, regeneration, and rejuvenation. Rasayana are certain botanicals, metals and minerals, animal products like ghee, milk, dietary recipes, therapeutic procedure, lifestyle, and behavior. Rasayana is an important approach that is being practiced in Ayurvedic clinic, and there is a specific Rasayana or specific approach for a particular person. Rasayana in healthy person may change according to environmental factors, and this particular approach works best in healthy condition. And hence, I'm emphasizing research on healthy people or research for restoration and protection of health status. It may need certain preparatory procedures. The Rasayana is always a tissue specific entity. We're not going to details, but I will request you to read this particular paper that is communicated in Journal of Ayurveda and Integrative Medicine by Dr. Kalpana Joshi and Dr. Ramesh Bonde sir, who is going to discuss some of the aspects in coming days. The tissue specific Rasayana it can be a very important approach. There has been research on Rasayana. Many papers they were communicated in last 10 years. Rasayana as adaptogens, how they can produce a normalizing influence, normalizing effect without alteration of any of the physiological systems. And hence, Rasayana as an adaptogen, there are many papers. Rasayana can really improve our adaptation limit and build our homeostasis. There were many papers, those talk about cardioprotective effects and Rasayana activity on Amalaki Rasayana and Rasa Sindur for longevity, development, fecundity, stress tolerance. Thus, there are many trends they have been very well explored in systematic studies. This is the paper published by Lakhutiaji in PLOS One in 2012. And they demonstrated Rasayana effects of two formulations. One is Amalaki Rasayana, that is formulation similar to Chavanprash, and Rasa Sindur, that is a metal and mineral based formulation that included mercury and sulfur. Rasayana, there are several mechanisms they have been proposed. For example, immunomodulation, quenching free radicals, enhancing cellular detoxification, repair damage for non-proliferating cells, inducing cell proliferation, self-renewal, neuroprotective effects, erosion of, arresting erosion of telomeres, and thus uh, strengthening healthy aging. Now, what is the ideal time to visit an Ayurvedic physician? How we can explore and utilize potential of Ayurveda? That there are several aspects. The cancer management and Rasana is a new area, and where Ayurvedic formulations, they are mostly used as add-on therapy in conventional cancer treatment, map for management of adverse events, address symptoms and ensure well-being, improving quality of life. Ayurvedic medicines, they are being used in several conditions for improving quality of life, and there are Ayurvedic medicines, they are also being used for preconditioning for conventional cancer treatment. And thus, there can be several ways Ayurvedic medicine or Rasayana can be used in cancer management. Yes. These are the various mechanisms they are reported or they are proposed by which it can be used in cancer. For example, adjuvant mechanism, angiogenesis inhibition, anti-tumor, apoptosis promoting, then anti-carcinogenesis, antioxidant, radio or chemoprotection, immunomodulatory mechanism. And hence various Rasayana drugs, they are being used to address fatigue, nephrotoxicity, chemotherapy, induced nausea, vomiting, wound healing, radiation, mucositis, and pain management. There are many papers, they actually report these particular clinical aspects. Vidania somnifera, our group is working on Vidania somnifera as a Rasayana in cancer. And we are studying Rasayana effect and immunomodulatory action, how it can improve cancer immunosurveillance and anti-inflammatory activity for inflammation-induced carcinogenesis. And thus, Rasayana related, for example, Vidania somnifera can be used as therapeutic adjuvant in cancer. We have communicated a review in Journal of Ethnopharmacology, Vidania somnifera as Rasayana in cancer and possible anti-cancer activities of Vidania somnifera, how it can affect several hallmarks of cancer. This is again synthesis of literature from that review. There are several studies by other research groups. They talk about Vidania somnifera in chemotherapy-induced fatigue and how it improves quality of life in breast cancer patients by using several fatigue scale. Ayurveda botanicals in COVID-19 management. This is an in silico study that we communicated last year, and we proposed a network of several bioactives and COVID-19 related targets, how Ayurvedic botanicals can be useful for addressing this target. This was an in silico study, got published in PLOS One. Then this is a short communication, and a paper is being communicated that Vidania somnifera as a safer option to hydroxychloroquine in chemoprophylaxis of COVID-19. We communicated results of an interim analysis where Vidania somnifera that was found better and safer than hydroxychloroquine. Vidania somnifera is also proposed as a vaccine adjuvant, and a recent study, a randomized double-blind placebo-controlled clinical trial is now initiated, where Vidania is being used as vaccine adjuvant in participants vaccinated with Covishield, and outcomes including safety, immunogenicity, and protection with COVID-19 vaccine. We are recruiting 1,200 participants for 28 weeks. And these are the outcomes. Those are specific to SARS-CoV-2 spike proteins and RBD specific IgG antibody titers, and safety, protective immune response, and quality of life measures. They are being studied in this clinical trial, and that has been, more information is available on clinical trial registry of India. Ayush 64, a formulation herbal formulation, including 4 ingredients. This has been found very effective for COVID-19 management. And this formulation that was co-administered as an adjunct therapy to standard of care in mild to moderate COVID-19 patients. This was a multicentric, parallel efficacy, randomized, controlled, open label, assessor blind, exploratory trial, and patients followed to complete 12 weeks of study duration. Participants included mild to moderate hospitalized COVID-19 patients. There were 140 COVID patients classified in 2 arms, where interventions were Ayush 64 tablet that was given as an adjunct to standard of care. And the another arm that was given only standard of care as per national guidelines of India for mild to moderate disease. Main outcome measures were time period for clinical recovery from randomization and proportion of clinical recovery within 20 days of time frame. And these are the results. Those are published on a preprint server, and the communication to journal has been made. And we hope that will be published in journal very soon. These are the results. Those are now uploaded on medRxiv. The mean time to clinical recovery from randomization was significantly superior in Ayush 64 group, and higher proportion of patients, they were in the first week because of this Ayurvedic adjunct treatment for managing COVID-19. Ayush 64 arm showed significant superior persistent improvement in general health, quality of life, fatigue, anxiety, stress, sleep, and other psychological metrics. And thus, the conclusion is the formulation that expedited recovery, reduced hospitalization, and improved overall health in mild to moderate COVID-19 when co-administered with standard of care. And this is the way how integrative medicine is being developed. This is the way how we can use best of these systems for benefit of people, even in such hard time of pandemic. There are many reports, as I discussed. Ayurvedic medicine is being given to a patient in form of a particular enclosure or a pudi, but that can be explored, the science can be explored further, clinic to research, and from research to clinic. And this particular approach is proposed as reverse pharmacology approach, where we can use Ayurvedic therapeutics, then exploratory studies, experimental studies, and development of Ayurvedic therapies. Ayurvedic therapeutics can also be developed for as modern development of modern drugs, or it can also develop used as Ayurvedic whole formulation in typical Ayurvedic practice. This is the thought by Dr. Ashok Vaidya. This reverse pharmacology is economical, time sparing, and a fast track path that takes clinical knowledge, clinical experience in lab, and we can expedite the research. Many times experiments on Ayurveda research, they only focus on therapeutics, they only focus on drugs, only oral administration, only herbal dosage form, and only convenient dosage form with only available experimental models. And hence, there are many convenience is involved in research, and hence if we understand the concept behind that particular substance, then our experimental methods and experimental models, they can also be better, and we can reach out to the simulation of reality in our experimental setting. And hence, why experiments on natural products have limited success in clinic. This is again a very important topic, because every one of us will like to see their research in real life clinical scenario. Every researcher has a dream that my research should benefit to people, and it should not just remain in a research paper. Why experiments on natural products, they have limited success? Because of experimentation in typical disease models, clinical subset and variations, they are not explored. effects on several tissues are not considered, and only certain dimension of a property of that particular drug is discussed. Friends, when we study Ayurvedic formulation, it is not a particular molecule or not particular fruit or root or not particular formulation. There are so many things they are important, how that is cultivated, collected, selected, how it is processed, and how it is actually used. All these aspects, they hold a lot of importance, and hence results on natural products based medicine may differ at some times. And hence dialogue with pharmaceutical sciences and Ayurvedic Vaidyas is very important, because pharmaceutical sciences, they are open-minded and curious people. That is my experience of working with colleagues from pharmaceutical sciences, because pharmaceutical sciences is the course that gives an exposure to lot many subject when a student completes his or her master's in pharmaceutical sciences. It's a multidisciplinary course, and they have multidisciplinary outlook, wide exposure to various subjects, and hence pharmaceutical sciences and people from pharmacy domain, they can do a good synthesis of traditional and modern systems. There are many research opportunities more than drug research, and this particular dialogue is continuously needed. We have tried in our Ayush Center of Excellence such a dialogue, and that network we have termed as Honeybee Network. Like honeybee, we can actually visit many flowers and get the nectar from various knowledge sources and enrich ourselves. There is a need for dialogue between faculty of pharmaceutical sciences and faculty from Ayurveda colleges. If we can share our experiences, share our resources, share our postgraduate students, then that can be a really synergistic combination, Ayurveda and pharmaceutical sciences. And that will really give rise to many innovative research projects and many endeavors in science. With this message, I thank all the organizers and pray for the betterment of community. Let there be peace and health that prevail everywhere in the world. Let us let us pull our prayers for the healthier world. With this, I thank you, the organizers, and all the esteemed audience. I thank Ayush Center of Excellence from Savitribai Phule Pune University, Ministry of Ayush, Government of India, because of which we are engaged in research of several aspects. And I thank my mentor, Professor Bhushan Patwardhanji, for his guidance and help. Thank you very much. If you have any questions or comments, then you can really share. Thank you very much. Yeah.
Thank you, sir. Now just we'll move ahead with the question answer session.
Very good afternoon, sir.
Yes.
Thank you for providing the informative insights onto this Ayurveda knowledge base. Question from the participant, sir. Vidyanolides are steroidal in nature.
Yeah.
Are they increase the steroidal load into the patients?
Actually, this is a very good question, and I don't have a direct answer to this particular question because we have not measured actually vidyanolides in say patients' sera, but one should calculate how much vidyanolide actually go in that particular patient. But another aspect of Ayurvedic formulation is they have a balancing role when And hence in which the condition in which they are administered, that also defines their role. And this is a question worth investigation, getting in PK studies, certainly.
Okay, thank you, sir. I will take next question. Where can we get the data about clinically used Ayurvedic medicines for the different types of diseases?
This is very important question, and hence not everything is available on internet, and hence there is a need of such a dialogue with Ayurvedic, people, Ayurvedic practitioners, and a dialogue with pharmaceutical researchers and Ayurvedic physicians will certainly end up in many innovative say ideas. But you can get an information. There are many resources like National Institute of Indian Medical Heritage. They have developed a portal. I will share links of such important say portals. I will send such links to organizers, and they will share those links with you. There is also a very good effort that is with the help of Wikipedia, and that is Charak Samhita Online. In this Charak Samhita Online, there is English translation of every verse of Charak Samhita, and that is very good work, and many researchers, they can also visit that work. So apart from these online databases, the physical interactions with knowledgeable clinicians will be certainly helpful.
Thank you, sir. A question related to the curcumin or diabetes. That is, curcumin together with the bitter gourd can lower the blood glucose level. At what stage of diabetes can we go for the Ayurvedic preparations?
Actually, Ayurvedic preparations, they can be initiated at the very beginning of diabetes. They can be also very useful for avoiding further damage. For example, they have a role of nephroprotective role, and role in chronic diabetics. We have possibilities of complications of retinal damage of blood vessels, kidney, and for protecting such organs, this particular combination of amalaki and turmeric, means avala and turmeric, or turmeric and bitter gourd, can be helpful. Yeah, so someone asked, please tell us regarding books which have methods of Ayurvedic formulations if we want to formulate them in phytoconstituent best. And so yes, there are many books like classical books. I will say Sharangar Samhita is the book, and English translation is also available. That book will really provide a very good information on pharmaceutics of Ayurveda, pharmaceutics and pharmacology of Ayurveda. There is a book that is published by, that is authored by Dr. Gokte and Dravya Guna Vignan. So I will also share list of such books which can be really helpful. But I would say this particular such sessions or such lists, they are just indicative. A good dialogue can be really enriching and helpful. Yeah.
Sir, one more question into the chat box. Curcumin as a ethosome, is this acceptable?
I'm not say I'm a Vaidya, and I do not say I do not know ethosomes concept, and hence I will not able to answer this question.
I
Yes,
request.
cancer cell proliferation can be controlled with Ayurvedic treatment for sure.
Sir, I'm having one question. Thanks a lot for your wonderful presentation. And of course, sir, one of your slide, it was telling about the pharmaceutical sciences bridging with the Ayurveda. Yes, sir. As I'm with the pharmacognosy, my experience is that whenever we are taking the help with the Ayurveda, it is definitely helping us, and the time taking for the research is being less. Sir, I wanted to ask, I wanted to know about whether any collaborations or any opportunities are there with the International School of Health Sciences, Savitribai Phule Pune University. How
Yes, sir.
SPPU department is looking ahead with the collaboration with the affiliated institutes? Is there any scope, sir, so that we are having the facilities at our analytical facilities, something common platform we can work together? Is there any scope, sir?
Yes, sir. We look forward to such a scope because we have this Ayush Center of Excellence, and this Ayush Center of Excellence that looks forward to development of a network of researchers. Those are interested in exploring Ayurvedic concepts and Ayurvedic interventions. We are welcome to all these collaborative efforts. We have implemented a very interesting program, and that program was student fellowship program.
Yes,
We gave fellowships, 10 fellowships every year, and not just fellowships, but training of research skill. And the students from various background, including pharmaceutical sciences, biomedical sciences, life sciences, they had their master's dissertations. And that fellowship program was for master dissertation. And we work with such master students, and in last three years we gave 30 fellowships. But along with those 30 students, more say 40 of them, they completed their projects. Those were related to some of the concepts on concepts of Ayurveda. And thus in last 3 years we worked with more than say 50 students from various disciplines. This particular interdisciplinary dialogue, that is very enriching, because as a Vaidya, I understand something, I do not understand something. As a person from pharmaceutical sciences, that person understands something, but that person may not have that clinical experience or that clinical insight. This particular dialogue is certainly helpful, because that makes us stand on a very different level when we share our ideas, our insights. And hence our school is Interdisciplinary School of Health Sciences. This is the time where we should work in collaboration with people from diverse discipline, because we have fragmented this knowledge just for the sake of administration of this knowledge, just because we cannot teach everything in a particular institute. And hence we have this particular pharmaceutical sciences, medicine, biomedical sciences, Ayush, and whatever. But for research, we have to pool our experiences, expertise, and thus that can be a very interesting journey. It is not just about getting our papers published in good journals, but it is all about our understanding. It's all about our satisfaction and our learning as well.
So any major thrust areas where your department is working currently?
Yes, we are working on Ayurveda-based immunomodulators as a thrust area, and Ayurveda-based adjuvants in cancer, Covid-19, and rheumatoid arthritis. So somebody said that online platform for faculty like us to learn through certificate courses. So Dr. Gurunani ji has a very good suggestion. Yes, we have certificate programs. Those 2 certificate programs we have. First, integrative dietetics, because diet is also a very important part. Ayurvedic medicine is not just a drug or a pill or a decoction. It has so many things as a diet, and nutraceutical is also coming up as a very interesting field. And we have this course that is integrative dietetics that combines Ayurvedic and conventional diet and nutrition approaches. So this is a certificate course that we conducted online last year, and we used to conduct on site every year. Another course we have that is Ayush and Integrative Health, where this course, this is a 5 credit, means 75 hours course that provides an introduction to all the Ayush systems to participants. And certainly we will like to organize, if the participants are interested, we can also develop such courses. Those will give an overview to participants from other scientific background, an overview and opportunities for interaction with Ayurvedic concepts. This is a very good idea. Thank you very much.
So there are some more questions.
Yes.
Metabolic profiling of Ayurvedic preparation, is it possible for polyherbal formulations or products?
Yes, certainly it is possible, because chemistry of some of the Ayurvedic botanicals or ingredients is pretty well known now, and it is certainly possible.
One more question about the medicinal plants for the treatment of psoriasis or skin diseases.
Yes, so yes, there are psoriasis is an autoimmune condition where many Ayurvedic, say, not just medicinal plants or formulations, but approaches like panchakarma and control diet, etc. They are very effective. And there are also a couple of studies and case reports which you will find where that explains the entire Ayurveda approach for psoriasis. Other question from Dr. Rohini Wagh: Rasana are sold as OTC drug, where it is safe to take Rasana without prescription and without supervision of Vaidya? Yes, very good question, and it is always better to take help of Vaidya and take with a supervision for beneficial effects, certainly.
Sir, one last question from my end. Generally, we talk about the Ayurveda, Rasayana, herbal formulations, polyherbal formulations. How we can correlate all this with the quality of medicinal plant raw materials? Because most of the cases we are collecting it from the wild sources.
Absolutely. And hence, now we should be very keen on this collection aspect. So there are also guidelines how we should. It is not just about collecting from wild sources or collecting from say cultivation by farmers, etc. But we should be very keen about the quality, and there are several standards, quality standards. They are mentioned even in classical texts. And along with those standards, we also need to employ the conventional standards of phytomedicine. Thus, utilization of both, that will be really helpful. But we also need to consider the raw material as well as processing as well.